The Glasgow Coma Scale has 3 components: eye-opening, verbal response, and motor response. These will be demonstrated in turn. Each of these depends on how the patient responds to either a vocal or painful stimulus, which we will demonstrate. When performing the assessment, the best response should be elicited. Each component should be assessed in a stepwise manner. Start off with assessing the alert patient. If the patient is not alert, then establish his or her response to a vocal stimulus. If there is no response to this, then you will need to perform a painful stimulus and document the response. Only if there is no response to pain is the patient deemed unresponsive. The response to each score should be documented accurately, and not simply whether the patient is responsive or unresponsive. Firstly, assess the patient's spontaneous activity.
Good morning, sir. I'm Nurse Mackenzie.
Good morning, nurse.
Hello. Could you tell me a wee bit about what's been happening to you, sir?
Yeah, I was leaving the house this morning. I tripped and fell and banged my head.
Okay. Can you tell me where you're not...
Here the patient is talking and moving spontaneously. No further stimulus is needed. The individual components of the scale can be assessed with voice alone.
Glasgow Royal Infirmary.
Okay, thank you, sir.
If there is no spontaneous activity, you will then need to elicit a response to your voice.
Hello, sir. Can you hear me?
When speaking to the patient, you must ensure that you speak clearly and with volume.
Hello, Mr. Murray. Can you hear me?
Speaking quietly will not necessarily elicit an accurate response to your voice, and may of course be a problem if the patient is in any way hard of hearing. Ensure all hearing aids are switched on and working normally. Make sure that you are speaking a language that the patient understands. Where necessary, you should ask a translator to interpret for you. And make sure there are no cultural barriers to the patients responding to your voice. For example, in some cultures, female patients should not be examined by male health professionals and may be unwilling to respond in these circumstances. Ideally, you should use the patient's name when you address them. Try to ensure you use the name the patient normally uses, for example, their nickname. Ask any friends or relatives to tell you what name they are known by. In certain circumstances, it may be appropriate to ask a relative or friend to speak to the patient, as they are more likely to respond to a familiar than an unfamiliar voice.
Hello, sir. Can you hear me? Mr. Murray, can you hear me?
If the patient does not respond to a clear vocal stimulus in any of the 3 components, and there are none of the previously mentioned communication barriers, then you will need to move on to eliciting their response to pain.
Mr. Murray, I'm just going to press on your fingernail.
When you elicit a patient's response to pain, you should start off by applying firm, sustained pressure to the base of the patient's fingernail using a blunt tool such as a pen or pencil. This should be done on the dorsal aspect of the finger, just proximal to the nail bed and not over the nail itself. A painful stimulus may also be performed by applying firm, sustained pressure to the supraorbital notch, which is located in the bony ridge above the eye. Another way of assessing the response to pain is to apply firm, sustained pressure behind the patient's mandible over the styloid process. You may also use your thumb and fingers to apply a trapezius squeeze. You should not elicit pain by rubbing vigorously over the patient's sternum, as this will cause bruising and does not elicit a good motor response. Similarly, you should not shake the patient. Nor should you use any implement that may actually cause damage to soft tissues. So the acceptable ways to elicit pain are pressure to the nail base, pressure over the supraorbital notch, pressure to the styloid process behind the mandible, and a trapezius squeeze. The unacceptable ways are sternal rub, shaking the patient, or pain on any other soft tissue area that may cause bruising or damage. Now that you have seen the different techniques that are used to elicit a response from the individual, we shall take the different components of the scale in turn, showing how these are scored. There are 3 components to be assessed: eye-opening, verbal response, and motor response. The eye-opening response is scored with a maximum of 4 and a minimum of 1. The verbal response has a maximum of 5 and a minimum of 1. And the motor response has a maximum of 6 and a minimum of 1. You will see that the minimum score for each component of the GCS is 1. This is to demonstrate that the component has actually been assessed and so avoids a score of 0. Starting with eye-opening, this component of the GCS has a maximum score of 4. If a patient's eyes are open spontaneously, then they score 4. If a patient only opens their eyes to speech, then they will score 3. If a patient only opens their eyes to pain, they score 2. And if there is no response, then they score 1. In this case, the patient has spontaneous eye opening and scores 4.
Hello, Mr. Murray, can you hear me?
Here the score is 3, as he only opens his eyes to speech. If the patient only responds to a painful stimulus, he scores 2 on eye opening. And in this instance, there is no response and therefore a score of 1. When assessing eye opening to pain, you should use nail bed pressure, as supraorbital pressure will only cause the patient to grimace. Moving on to verbal response, this has a maximum score of 5. Use the same procedure as described before when assessing the verbal response. A score of 5 is given if the patient is fully orientated in time, person and place. 4 if the patient is confused, which means they are speaking in sentences but disorientated. A score of 3 is given if the patient only has inappropriate words. 2 when there are only incomprehensible sounds, such as moaning and groaning. And 1 indicates no response. Begin by talking to the patient and assessing their response in conversation. To have a score of 5, the patient must be orientated in time, person and place.
No, I remember everything.
Okay. Sir, can you tell me where you are at the moment?
In the hospital,
Okay, and do you know what the name of the hospital?
Glasgow Royal Infirmary.
Okay, thank you, sir. Sir, can you tell me what day it is today?
It's Friday,
Okay, and what month is it?
September.
Okay, and sir, could you tell me your full name, please?
John David Murray.
Thank you.
In this example, the patient has a verbal response of 5 as he is fully orientated. He knows where he is, what day and month it is, and his full name. A verbal response of 4 is given to those patients who are confused.